Hello, my fellow CRPS sufferers and my chronic pain warriors out there. I wanted to do a quick video today about pain pumps. Now, I did a video a while back about ganglion nerve blocks and peripheral nerve blocks, and I actually happen to have a pain pump on board right now. And I've never had one of these, and so I wanted to talk about it because as a chronic pain sufferer, they try to do so much to help us. They offer a lot of nerve blocks and a lot of different things. But what happens when you need to get surgery on your affected limb? So for me, my primary injury site and my primary CRPS, complex regional pain syndrome, my main site is my arm. So mine was caused from a dog bite. It was my dog, my very sweet little dog. You know, I'd show her, but I guess she's out sleeping somewhere. She bit me. It wasn't her fault. She had a spinal injury that day and was in pain and was scared. And she actually bit my daughter, my adult daughter. And then I stepped in, and so she ended up biting me. So that's how I got CRPS. Well, because of having CRPS and having all of that, you know, most of my treatment, and I don't know if you've had the same experience, but most of my treatment, and excuse me while I make a little cup of coffee because, oh man, I really need it today. But I have only really received pain management. I actually have not received much treatment for CRPS. Now, I did receive treatment for the break when my dog bit me. So I had gone to the emergency room. They put my arm in a splint, and then I had a cast. And that when I had the cast, that's when the symptoms of CRPS started. And I think it was because I had some untreated compartment syndrome from the bite itself, and then I had my cast was it was too tight, and I didn't realize what I was feeling, and so I didn't go back to the doctor straight away. I should have, but whatever, unfortunately. So I did get treated for my initial injury, but once I got diagnosed with CRPS, they were like, hands off, we're not touching her, we're not doing anything. The only thing that I have done for CRPS is, besides pain management and having nerve blocks and medication and everything else, is physical therapy, or physical therapy and occupational therapy. Occupational therapy is more for like the hand and the wrist, where physical therapy is more for the rest of the body. Now, I had developed frozen shoulder from having the CRPS because it basically, when you have an injury in your arm, it's like the action of guarding it, like even if we do it like unintentionally, and that caused me to get severe frozen shoulder. And thank the Lord that physical therapy completely resolved my shoulder. But we got to the point where I have really severe contracture in my fingers, and so I'm not able to make a fist. So right now I could go like to about here, and then like about there, so about like that was my range of motion. And so I'd gone to Stanford to see the hand surgeon and pain management there at Stanford Hospital here in California. And this is now my injury was a year and a half ago. So I've been going through treatment for a long time. So where I'm at now is very different from where I was in the very beginning. So I've had a lot of the nerve blocks. I've had 5 Stellate Ganglion nerve blocks. And that's where they put a shot into kind of like your neck area, and then they put the medication, like the numbing medication, into the whole nerve branch, which is about right here-ish is where the shot goes, because you have like a little bundle of nerves, and then it kind of goes down the arm. And then I had the peripheral nerve block where they did a shot here and here because it's my radial nerve that they were trying to do work on. Well, it got to the point where the doctor was like, you know, I had done so well with physical therapy or occupational therapy that she wanted to do a manual manipulation under anesthesia. And that's where she would take my hands when I was knocked out. She would take my hand and actually try. Now, she said she could not extend my fingers, but she could try to break through that scar tissue or whatever that is, whatever that stuff is that holds the fingers in contracture, that she was going to try to break it, because I had made such good progress on my own, just forcing it and going to occupational therapy for all this time and really just working it. I had made enough progress where she felt that maybe she could get me a little bit further. Well, then when I went to my pre-op appointment, so we set the surgery date. I went ahead and I okayed it, and I okayed it with my pain management doctor and everything else. And then I went to my pre-op appointment, which was a week prior to surgery, and she was like, I had continued to do my own physical or occupational therapy, and so I had made some more progress. And so she said, since you're already going to be here, do you want to try doing a radial nerve or a radial tunnel decompression? And that's where they take the actual radial nerve, cut through the skin, go to the nerve, and basically free it from anything holding it back. So anything that's compressing that nerve, you can kind of think of it like if you have a hose that's been left like out in the ivy or something, and then like the roots kind of start wrapping around the hose. It's basically that, if you think about it like that, and how it squeezes, like the hose, it can actually squeeze the hose. Well, not literally a hose, but I guess the nerve, it can get compressed. And so the concept is they go in there and they literally like strip everything off of the nerve so that the nerve can flow, like the pathway is unencumbered, so it could just freely flow and just work like it's supposed to work, right? Well, I was definitely all for that, because oh goodness gracious, after a year and a half being in pain and having such a lack of range of motion, and I've lost my job, my mental health has been affected, my relationships are affected. I mean, this has just been a traumatic life experience. And so I was like, what do I have to lose? Yes, I mean, it could, anytime you have surgery on your affected limb, especially with CRPS, you're risking spreading it to other places. Now, I've already had CRPS spread. I've already got it in my left hand and my left arm. I've got it both in my feet. I have it all around my face and on my tongue and inside my mouth. But it was like, I have the good insurance right now. I don't know what kind of insurance I'll have in the future after my husband retires from his job. I don't know where I'll be in the future. And so it's like, we don't have time. I don't feel like I've got the time to just sit around and wait for something to happen magically or any other way. And I know that I made a lot of progress like on my own, but this has been rough. This has been really rough. So I was like, you know what? I trust her. Let's go for it. Let's do it. Well, so what they came up with a plan for pain management, and the plan is that they were going to send me home with a pain pump. Now, the pain pump is basically where I have a catheter. Let's see if you can see it. It's very hard to see, but there's a little wire that goes into my skin. That's actually a little bit of just like blood, and then there's like a little cushion pad over the top, and then that's holding it. And then this is like a contraption that there's nothing inside my skin. It's more just holding the tubing. And then I put the contraption into a backpack, and actually let me show you what that looks like. But it is like attached to my body, so it's like. But I also want to talk about the radial nerve decompression surgery itself, whereas I tend to get really bad rashes whenever I get any sort of nerve block. And sure enough, I've got a terrible rash. Oh, can you see that? It's bad. Oh, and then there's the site. I have some. I just took the bandage off just so, because it was starting to swell like around the site. Now this is actually day 5, so I had the surgery on Monday and today's Friday, and so I put a line around where it was red, and it actually has exceeded that area, but that's how big the scar will be right there. You see how I'm kind of, it might be hard to see, but I'm kind of like extra swollen in this area. And before it was like I was just swollen like all the way through. So I'm gonna call the doctor today and just see, you know, what's going on, you know, like, should I be worried about that? So here is the pump. You know what, I need to go behind myself to get the more wire. There we go. Okay, so here is the pump. Make sure I have it right side up. Yeah, and sorry about the lighting. And so it tells you, and so what this little contraption does, it does have a strap. Oh God, I just whacked myself in the face because the numbing, this thing, it just pumps out this glorious numbing medication into my arm. And so it has been the best. It's like bad and wonderful at the same time. For someone that does not experience chronic pain, nobody could possibly understand the relief that this is giving me for these 5 days. I still have, like, right now, like, my hand is burning really, really badly, but my arm is numb. And when I was in the hospital, I was like a limp fish. It's like, I actually, it's like you have no control. You might as well have like a piece of firewood attached to your body. It's like, it's so crazy when they do these peripheral nerve blocks and the pain pump block. Oh, excuse me. But and I actually like whacked myself in the face with my hand because I couldn't control it. So if like a doctor, like when you go into the operating room, you have to scoot over from the bed that you're on. You have to like scoot to get to like the operating room bed. And there was a doctor there, and the doctor that had done like the nerve block, and she was holding my arm, but then my robe had gotten like snagged on something, and so she let go of my arm to try to help me get unsnagged, and then my arm like whacked me like right in my forehead. But the thing is, they had put something in my IV already, so I was already like a little loopy. And so I was looking at her face, and she was just like mortified that she had just let my arm like hit me like in the face. And I was like, don't worry, it's okay, you're forgiven. And then I couldn't remember what the word was for forehead. So I was like, it's okay, my hand only hit bone, it didn't hit my eye. And so she was like, did you hear what she said? She said it hit bone. And so she was like, she was mortified. She felt so bad, but I was like, I couldn't remember forehead. But anyway, but but the thing is the fact that the doctor was willing to send me home with this pain pump. What a remarkable, wonderful invention that they have created. Now, the one thing that I do want to say about it is, one, it's kind of difficult because you're attached to something for 5 days. It's now 5 days later, and I have not like been able to really shower for two reasons. One, you cannot get any of this wet, but technically I could take a bath, and I literally could just take, a bath, which I probably will. But the thing is because of my arm kind of being a little floppy and being a little bit out of control, I just don't feel very comfortable. I have cleaned up with using like a washcloth and soap, so I have like, cleaned myself up. I'm not dirty, and I cleaned under my armpits and everything, and so it's like I'm not dirty. I just haven't taken a full bath. And I have not washed my hair though. That was like pushing it, but I did just put some like dry shampoo in there. But the thing is so this is something that if you need to have surgery on your affected arm, is you've got options. They might offer you a pain pump, and if they don't offer it, you could ask for it, because this is making it tolerable for me. And what it's doing is it's hiding this injury from my brain. We don't want my brain to know that I got hurt. And so the longer I can heal with my arm, the better, because it's like then when I remove the pain pump, then I will have less of a pain. And so it might not trigger CRPS to explode, because that's the worry, is that it's just going to go bonkers haywire. Because the thing is I have been on the spectrum of CRPS pain. I have been in the burning freaking hell of the high end CRPS. I don't ever want to go back there. Oh my gosh. I am so blessed to be one of the people that has benefited greatly from the stellate ganglion nerve blocks. Those worked for me. Now they are not 100%. I'm not going to give anybody the illusion that you go in there, you get this shot, and then you're fine. I actually, what happens with me is I get the shot, I have a humongous flare for about a week and a half, and then somewhere in that second week, one day, one moment, I just have this weird like moment where I'm like, wait a minute, my pain is a little bit less right now than it was before. So it takes time. It's very it's like a stepping down through for me for the nerve blocks. So I started at a 10, and then I got my first one and I came down to an 8. Averaged 8, but I could still go up. So I started at 8 and I could go up to a 10 on the pain scale, that is. And then when I had the next one, I kind of dropped down to more like, like a 7, and I went more like 7 to 8 to 9. You know what I mean? So it was like it's just stepping down. And so now that I'm at a 5, I've had 5, my pain level ranges on my baseline pain level is usually around a 4. As I'm active and as I go throughout the day, then it goes up to a 5. If I do something, or it doesn't even have to be something that I've done. It could be that I heard a loud noise, that there was chaos in a room, that I heard fighting. Earlier today, I heard, I live a little elevated on my street, and there's a little, I live in the mountains, and there's a road that's right down below my house, that I'm at the very bottom of the hill. And so a lot of people pass my house with their dogs, and there was a dog encounter and just like an hour ago, and they actually got into a fight. And so I heard a vicious dog fight. And so I had to get up, run to the window, and I saw that they both dogs had their owners. They were pulling the dogs away. It was controlled. But just hearing that dog fight, and even me talking about it right now, is making my fingers pulsate. Now, I don't know if you experience that same thing about being so sensitive to emotions. So if I'm really, really happy, or if I'm really, really sad, or if I hear some very emotional thing, or if I hear a loud noise, my husband has a very loud cough. It's just a cough. But he does it a lot. He has like a chronic, he has kind of asthma. His cough triggers my CRPS. So it's like, I'm very, very, very sensitive. And so it's like I can go from a 4 to a 6 within a very short amount of time, but then I can come back down to a 4 if I can get kind of some meds on board. So I'm constantly fluctuating. I'm not stable. I would not consider myself stable, but I'm just at a lower level of my pain range is on the lower side. But this, having the option to be able to have a pain block to keep me there at that lower phase so that I don't go back up to like an 8. Now, on day 2 of surgery, I was at an 8. I was, one of the ways that I know for myself is if I cry, if pain makes me cry, then I know that it's above. Because sometimes when you're in a lot of pain, it almost becomes difficult to even identify it, because it's almost like brain numbing. Like for me, it's like I kind of just like, I'm so focused on the pain that it gets harder to identify what is actually hurting. But if I actually cry, I'm usually at least at an 8, at least. But that's just me. We all handle pain differently. I've unfortunately had a lot of chronic pain conditions throughout my life. So I think I can't speak for anybody else, because it's not, I only know my own body, but I feel like I handle pain pretty well. I think I do. Maybe before CRPS, I thought I did. Now that I have CRPS, I don't know, because I don't feel like I can tolerate CRPS pain. CRPS pain is like in a league of its own. It's something that I can't really even like describe, like how bad it can literally like feel. like right now it feels like my hand is on top of the burner on the stove, and it's like, yeah, I don't know why my brain is thinking my hand is on the stove. It's like, it's not. It's just sitting here. It's not doing anything. I'm not moving it. My arm is numb. I can move my fingers this much. I can't even move my thumb right now. It's like I'm so numb. But I just want to really encourage you to look at this whole pain pump. And you know what I did is I kind of showed you that I just stuck it into, I just found like this little backpack that, you know, was around the house, and I just stuck it in there just so I can walk around the house a little bit more freely, and just have, because you know, when you have a backpack on your shoulder, how you have to kind of like crunch your shoulders to kind of hold it up and stuff. But anyway, you know, I'll let you guys go, but I just, you know, I really just, you know, just hang in there. I'm so sorry that you are going through this, or someone you love is going through this. It's really kind of a nightmare. And, you know, I just send, you know, my prayers to all of you, anyone watching this video, that you guys will find some healing, some pain control, and you'll find that magic formula that works, you know, just, you know, especially for you. Okay, you guys, have a great day. I'll see you next time.